by way of introduction, I have Dr. Dhaliwal, Dr. Ajit Dahilwal, joining us today. One in the lab coat. I will say up front, I forced him in the lab coat because I said, you went to medical school, you did residency. People should know that you're not just some quack that an MMA fighter strong armed you.
I want to point out that the last podcast we did, we were wearing like hoodies, and so I showed up in a t-shirt, three-piece suit, and just rubbing it in that he's a doctor. So not cool, but whatever. He live with our
Good. Makes us look good.
great.
But we called this one together because, frankly, right now the topic du jour is stem cells and peptides. It's been all over the news, especially lately with some things that might be happening in legislation in July. But there's just a lot of questions, a lot of confusion. Yeah. It feels like the Wild Wild West in a lot of ways. And I have questions as somebody who's aging through it. And I'd love to bring in an expert to talk about it. And so, Dr. G, maybe you can introduce yourself a little bit, what you do, and your background.
Of course. So I've been a physician for about 15 years now, even though you said I look young. Thank you for that, stem cells. So I initially started with internal medicine, was working in a hospital about 13 years. I actually got injured playing hockey. I'm Canadian, so it's my birthright. I did everything, got surgery, did the PT for 6 months, nothing helped. Then a friend told me to go get stem cells. I was like, no offense to Mexico and Panama, it's like, you go there, there's no follow-up, I don't know what's gonna happen. He told me about this lab out of Atlanta. Because I'm a physician and it's research-based, that I could go there and get an injection. Changed my life. Was working in a hospital, academic attending, teaching residents and all that stuff, and I'm like, I quit. I'm gonna start my own clinic. Just because of that.
Full quit.
Full on, I was like, I need to do this. I'm like, this is the future of medicine. Like, I just like, when it changes your life and you're like, oh my God. You're like, it was like Popeye eating spinach. I was like, okay, we can do this now. And I was like, because you have to understand before that, and I was, my kid was 4 months old and I was in pain just holding up my son. It ruins your quality of life. And I did everything right? I did the surgery. I did the PT. I did everything I could, and still to no avail. So now I'm like, is this going to be my life from now on? I'm just going to be in pain every day? So I needed something. I tried other things, and this gave me my relief and gave me my life back.
Can I get specific? What was the injury? What was the surgery? What were you? Because
I like torn. Yeah. So it's playing hockey. I tore my elbow ligament.
Okay.
This affects everything, and it's like it really even affected my work. Like when you're auscultating the back, like you're listening to the lungs. I had to do it with 2 hands, because I literally couldn't. Because you're in so much pain, you get weak, and like you just start using one hand, and then you're not used to using that one hand, and you really kind of become dysfunctional.
So what kind of surgeries did you attempt before you went?
No, so we got the ligament surgery, which helped for a bit, and of course surgery was needed at that time. I mean, it was partially ripped, but then it was like you expected some sort of relief. You got to be patient. So we did the PT, tried to strengthen the tendon. It was brutal, because it was like you're going through. It's a progress. It's a journey of recovery. You have to take pills just to get by. I'm talking about like ibuprofen, or thank God it wasn't the harder stuff. But some people have to do that just so you can function. That's kind of brutal. Like you're relying on medications just to be functional in your 30s. So then finally, you just become desperate. You're like, I'll try anything. Try the snake oil, try whatever you want, and then you're like, at least stem cells have some research behind it. So went and did that, and totally changed my life. And I'm like, I need to do this. This is my calling.
So, obviously you're saying stem cells, but there's a lot of myth around what stem cells are and what's a good stem cell, what's a bad stem cell. So can you break down what is a stem cell and what are maybe 3 things somebody should be doing research on before they go after treatment?
Yeah, that's a great question. Well, one thing is like, what made your body? What are stem cells? They basically are the ingredients that made the recipe, that made the dish. The dish is your body, who you are. Stem cells basically made the organs in your body, the limbs, the eyeballs, the hair. That's what stem cells are. They built your body, right? Now, 3 things about that. Now, this is why people get skeptical and people are worried about stem cells. 3 things you should do before you get stem cells, which I think is the future of medicine. First of all, I have a question. what do you want out of your body? Like, what do you want? What are you trying to gain? What's the outcome that you want? If you pursue stem cell therapy, which is to repair, rebuild, and regenerate, right? And reboot your system. What do you want from stem cells, though? That's the real question. What do you want from it?
Sure, I'll do it, and then I'll have Sean say it. But as somebody in their 40s who used to fight or compete competitively and went through damage, I want to be able to function like I used to. I want my body to move like it used to. I want to have the energy I had when I was younger, and I want to, feel like I can fully recover after I go do an exercise.
Yeah, I mean, I think that's the case for a lot of athletes or former athletes. I work in sports radio. We're around those people a lot. We were both professional fighters. I'm still around those people a lot. A lot of people are turning to stem cell treatments. And a lot of the time, it's just to restore a function that was lost, right? Used to be able to touch my toes. Now I can't. Used to be able to put a shirt on over my head. Now I can't. My shoulders are too messed up. My elbows are too messed up. Our coach, his neck is like 1/3 the function of what it used to be. So I think the restoration of what your body was before you ruined it is probably what a lot of people are looking for.
No, exactly. And before I tell you about like what you should be, what you should ask, let me just give you an analogy. Obviously, like stem cells are the building blocks of your body, right? Like we discussed, but that's when you're growing up. Now what they are, they're construction workers. So for example, your body is like a construction site, right? So as you age, your crew basically becomes thinner, right? You have a crew, like a working.
Yeah, it's more of a demo site than a construction site. Yeah.
So you have the crew there, but then after you're building up the house, you're kind of like, they go find work somewhere else. And as they do that, then you have these other cells that come in, senescent cells. And they're basically like zombie cells. They don't work and they don't die. And they kind of suck up all the energy. And that's what happens when you age. You get more and more of these senescent cells. These guys that, they just suck up all the energy. They kind of screw up everything. You got your truck bringing in the lumber and everything, and they just block that way. And they just kind of just starts disintegrating. What we do with stem cell therapy is we bring in the crew again. We get a brand new crew, not only to repair, to rebuild, but regenerate. And what they do, though, before they start building, they start clearing up the mess, right? The senescent cells have done, the zombie cells. So as you age, you get these zombie cells that cause chronic inflammation, and your receptors get clogged up by them. So what used to work well before, slowly your body with chronic inflammation is sucking up all the energy from the mitochondria, the oxygen, your skin, your organs. So they slowly start to age. But what if we cleared some of that stuff up? What if these construction workers came in, cleared up those cells, started repairing the house without these people, these cells sucking up the energy and, clogging up the ports?
I'm going to ask a dumb question right now. When we hear stem cells, my vision is you just got like this vial full of whatever, blank cells that you're going to inject somewhere in the body. They're doing all that work, then they're becoming the building blocks, then they're the healthy muscle tissue. I mean, is there like stem cells that eat the bad stuff and then they move out of the way and then the good, like how does that work? Is there a differentiated process? Before you put them into the body, have to say, all right, this is going to be the muscle that we're healing. This is going to be the tendon or the bone or the ligament or the whatever. But this year there's some autophagia going on. We got to get this stuff out of the way first. Like, is it a process like that, or is it just kind of magic? The stem cells know what to do.
So a little bit about both, right? A little bit about both. So, for example, like when they go in, your stem cells already know where the damage is, but they also have helpers, right? They actually tell the, phagocytes and the NK cells, which is natural killer cells, to go take care of these zombie cells. Clear it up for us. We need to work on this. These are a blank slate, but what they do, they can become eyeballs. They can become tendons, ligaments, and things like that. But first they go and repair it. They see that the damage is somewhere. In addition to that, you also have exosomes. You already have stem cells in your body. Exosomes are like the messenger cells. They're like, hey, we're damaged. They send out exosomes in your body naturally. So when the stem cells come in, they already kind of know where to go.
They're homing in on that.
They're honing in on that. And then when we do like targeted therapy, like in your shoulder, we're kind of guiding them. Like, listen, you don't need to keep going in along in the body where you know where the damage is.
Interesting. Is there any risk associated? I mean, rogue cells in the body, that's cancer, right? So is there ever like a downside to this where there's too much in terms of like the amount of stem cells that are being injected, and then maybe you don't have a perfect organization of they don't go to the place where they're supposed to go, and so they just become a growth here or a something else there.
Yeah.
Are there risks associated? Because we always hear about the good stuff. There's so many of these great success stories. I mean, really famous ones. Peyton Manning fixed his neck, and we know guys from the Fight World Hall of Fame. Matt Hughes was in a really terrible railroad accident, and he's restoring a lot of function to his life. You never hear about but watch out for this. I imagine.
Yeah. So when we say what are the three things?
Contraindication is obviously ongoing cancer. We don't want to pump up and help repair the cancer cells.
Yeah.
That's a big contraindication. Like for us at Regen Health Physicians, we make sure, with the intake form and everything, medical history, labs, we don't touch anyone that's had cancer within 5 years. But if it was like, say, it's small cancer and it's completely gone, eradicated, everything, then we get the clearance from the oncologist. You could have a cancer that could be benign. We still want to make sure that we don't even, it's not even a slight chance. Because at the end of the day, we're trying to keep you safe. And also repair, regenerate, and try to get you back to what you were doing before.
So you're saying one thing to watch out for before you start is get a cancer test or get a scan. Like what's the process? Like, do you guys, I mean, actually, maybe we should talk a little bit about your clinic too, because what I'd love to know is like, before somebody comes to see you, what are like 3 things they should check off first, or what are things that you will check off for them? Because if I was the average person, I'm probably not going to go get a cancer screening before I come and try and get stem cells, unless I have somebody educating me.
So usually with like, for example, with cancer cells, you are going to see, some red flags like in your labs, right? We always check, we try to review your labs even within 6 months. You don't need to have, that's good enough because you'd see, white blood cell count. We ask you how you're doing. If you're having night sweats, we have a problem there. Why are we having the night sweats? We have to do a full medical intake.
Do you do a thyroid panel and all that too?
So we usually, like for thyroid panel, that's not really a necessity. It's more of like a CBC. We want to check how your blood levels are doing, because if we do IV stem cells and you have some sort of blood, dysplasia, blood kind of cancer, then we're going to have an issue, because we're going to help leukemia or lymphoma or soft tissue, whatever it is, kind of grow. So it's really important. I'll see the medical history is always the biggest thing, and that's throughout medicine. Like, you have to ask questions like, how you've been feeling, what's going on. I know you want to fix your elbow, but how else have you been doing? We go through the whole medical list because we are a medical clinic. Then we get the baseline labs, and that's what we have to look for. We have to look for things that are abnormal. And only then do we say, okay, maybe you should go check up with your primary care physician. Your liver function's a little out of whack, plus your white blood cell count's very high. You need to go check that. Do more testing. Because the last thing we want to do, and I hate to be redundant, but is to cause some sort of harm. Being a physician is we want to benefit, it's benefit, not cause harm. Cause no harm, right? I mean, that's the biggest thing. So just because we're going to like, oh yeah, regenerative medicine is great, I got to keep you safe. That's my number one priority first. Yeah, I would love to treat you. I'd love to get you back feeling like you're 20 again, that you can hike and everything like that. But we need to make sure we don't do anything harm.
Okay.
And I got to make sure of that.
With that, I mean, ultimately, if you've got a problem, if I've got a bad back, which I do, and I want to come see you, right? Well, I'm one of these people who's like, all right, where do I go? There's a lot of people going overseas to get stuff like this done. There's a lot of people going to Mexico, to Costa Rica, to Panama, to whatever. I don't know even the right questions to ask about regulation, about where these stem cells are coming from, about whether or not the clinic that I'm going to is run by actual MDs, people who've taken a Hippocratic oath and have to worry about, these like ethical questions here, because obviously this is also an industry. Yeah. And it's a growth industry, and it's a startup for a lot of places. So if you're the person listening to the podcast and you're like, well, I would like to check this out. How do you source this? How do you make sure that you're going on Ajit place?
No, I mean, that's so one thing about overseas, and these clinics are remarkable. Panama, Mexico, Colombia, and they're great. The difference that what we have here is it is regulated. For example, first of all, with the stem cells, right? Our stem cells for region health physicians come from an FDA-approved lab. To be an FDA-approved lab is very important. They go through a lot of regulation, right? Not only that, our stem cells are third-party tested. So it's like we screen them for every sort of disease. Like it's extremely regulated in that sense and monitored, right? And then also, you also have to see who's overseeing this. Is it a physician or is it that salesperson you met in the lobby? Now, these red flags that you need to look at, the biggest one I always say is think about their marketing. Are they saying things like miracle, cure? No, that's right away, that's a red flag. Stem cells aren't here to cure. Stem cells aren't some miracle. I mean, I think they're a miracle, but you're not supposed to say that, right? This is not a cure. This is a remedy. This is a treatment. This is therapy. And you see that though. You see that in certain clinics and, oh yeah, trust me, you can cure this. You can't cure anything. You shouldn't say that you can cure anything. When you start saying like that, when you start saying things like that, you get false hope. And also, the biggest thing, make sure they ask you a serious question before they start selling you. If they don't even know what problem you have and they're like, oh yeah, by the way, this package is this much. Hey, this package is this much. Walk out the door. Like, you look like you need this. And they're like, I haven't even said a word. I haven't told you my name yet. Walk out the door.
I'm glad you're bringing up packages because there are other clinics. There's a lot of places. They're popping up everywhere. And what we're seeing a lot of clinics do is they're now doing the other big side of this, which is peptides. And your clinic is one of the few clinics that seems to be doing a good job marrying stem cell treatment with peptides. So when it comes to the world of peptides, that seems like even more less researched or less reviewed, or like there's less history around it. How are you guys deciding what peptides to use, and how do you determine that for the individual? And basically, back to Sean's question, is like, how do I make sure I'm going to a good place if I can't come out to Utah, or coming out to New York? Where do I do my research to make sure I'm going to a good place?
And that's a really good question, because like, first things first, not all peptides are the same. Now you gotta see where they're coming from. China's great, honestly, 99%.
Sorry, I'm gonna interrupt you. Will you actually explain what peptides are at a high level?
Oh,
let's break it down. I know it's a dumb question, but I'm a dumb guy. So
no.
Let's do it.
Let's put it like this. Back to the analogy. Stem cells are construction workers, right? Exosomes are the messenger cells. They tell us what we need to do. Peptides are the work order. Fix this. Lose some weight. Increase fat metabolism. Increase GH growth in your body, right? Your construction site. They're the work order. Okay, fix the front door, which could be, let's say, energy levels, NAD, right? Or fix your cognition, NAD. Okay, so that's a work order. So let me put it that way. This is a part, peptides are not some miracle. Peptides they're a part of the protocol. They're part of the package. They're not the package. They're not the stack. They're helping build the site, the house that we're trying to build. They tell us where we need to focus on. If you have low energy levels, it's going to tell you to focus on the front door where the NAD is. Work on those receptors. And again, what's really important and why this works and why we do our protocols is because we need the stem cells to come clear out that space. Because when you're painting the door and you have sludge cells here, you can only paint half the door. You're only working on half the receptors.
I really like this analogy.
So you need to clear it out, then they can fully work.
To take your analogy, you can have a work order, but if you don't have the workers to do it,
Exactly.
or you don't have enough workers, it's not doing it. So if I'm hearing you right, it's peptides on their own can only do so much. They need stem cells to really amplify. Is that what you're saying? Or am I putting?
They work synergistically, right? They work so synergistically. Like with ours, I understand stem cells are very expensive. I get it. You know, we're in the longevity game. But we do have like an intro IV, which is, more reasonable because I just want to prime your system. We want to just get the stem cells in there, do as much cleaning as we can, then we do the peptides. You don't need to go for the whole shebang just yet, but we just need you to prime that up because a smaller dose will make a bigger impact if you clean out all that junk, right? All the senescent cells. Does that make sense?
Peptides are synthetic. You can synthesize peptides?
Yes.
Okay. What about stem cells?
Can you synthesize them?
Can we synthesize stem cells, or do stem cells have to come from?
Where are they coming from?
They're coming from, for us, in Regen Health Physicians, they come from the umbilical cord.
Okay.
So these cells just made a human being, right?
Yeah.
So they're still a blank slate. So what happens is you extract them, you take them to a lab, you make sure they're clean, they're probably tested. Then they go through passages where they basically get replicated. Here in America, we can only do up to 2, really, right? 2 passages where they replicate. But if I, for example, inject you with 25 million stem cells, they're going to replicate in your body to 100 million.
Okay.
Who's umbilical cords?
Yes. Where's this coming from?
I mean, you can just go to a hospital and ask for one.
Really?
No.
Because I've had 3 kids. Then the umbilical cord's like, did they take those stem cells?
No, so they're actually donated. The ones that the lab that we utilize, they actually get from donated. They're donated. For example, a lot of this is like it's for research based. It costs money to keep your umbilical cords of your children, right? And then not only that, after you keep it in the freezer and everything like that for many years, you're gonna have to pay someone to go extract them, then go to a lab to third-party test them to make sure they're clean, and then pay someone to actually inject them into you. These work well for like blood dysplasias, blood cancers, things like that. That's good because you can utilize that for like your children if they have leukemia or something like that. These are donated, and it's for research. Because right now the main indication for stem cell therapy, stem cells in America is for research. That's why in New York we can apply stem cells because we do case reports at Regen Health Physicians. In places like Utah, Tennessee, and Florida, you can apply them in a clinical setting.
Great.
Without research.
So I like that. They're donated, but what kind of screening happens on the donation? Like, are they good donations? Are they bad donations? How do we know the quality of the stem cells?
You take the demographic, information. And then with that, it depends on what the lab wants to disclose to you or doesn't want to disclose to you. They're a blank slate, so they become whatever you want them to become. Funny enough, this is so bad, but I want to tell you something. There's other countries want American Caucasian stem cells. I kid you not. They're at a higher price, and they don't want I'm screwed, man. I'm the doctor who's clearly not Caucasian, Canadian. I didn't. It's so on the black match, it's like, oh, this is LDS stem cells. And funny enough, I actually had a patient asking if the stem cell that we use, are they from Utah? I'm like, why? He's like, I heard that LDS stuff is like the best kind. I'm like, what?
They look so clean. This
is a total aside, but have you seen they did that study where they tested if people could visually distinguish a Mormon from a non-Mormon just with a picture of their face? And people, random people on the street, were able to identify Mormons with 80% accuracy just with their face, like that Mormon face. The more serious part of this question is the ethical source.
I think you can say it. We can't.
I was like, I need to be professional, but I mean, call it what it is.
I like it. You know what? You think doctors are all stodgy and super professional?
For some people, there is a serious question about a moral or ethical sourcing of stem cells because of, did they come from aborted fetuses? If you're someone who doesn't believe in abortion, you don't want to support what you might consider to be, a macabre industry, things like that. I was raised in a very Catholic home, and that's a huge thing, right? So I think there's real questions about that. And when we're talking about which clinics are using which, is that something you can just ask your doctor?
Absolutely. And you should. So that goes back to your other question. Like, what are 3 questions you need to ask? 1 is, what do you want to do with your body? 2 is, who's actually doing it? Who's overseeing this protocol? Is it a physician? Is it a salesperson? Is it just like a med spa? Or is it an actual medical clinic? 3rd, what are you putting in your body? Where's it from? If they can't answer that, walk away. They need to be third-party tested. Our stem cells, like we know, are from live C-section births, right, here in America. Our lab they're third-party tested because we get the certificate of analysis. They don't have CMV. They don't have EBV. We make sure what we have, because that's our product. And we're putting it in your body.
Yeah.
This is not like, oh, you take Tylenol. No, this is like going through your veins, your artery. This is going through your body.
Yeah.
These are you don't want some drunk construction worker trying to build up your house. And all this stuff is important to ask. You should be very, very particular and strict about what you put in your body.
Yeah, be judicious because you can't pull it out once it's in.
Yeah.
Bless you.
Hey, speaking of which, if you're going to so rudely interrupt us,
Perfect segue.
Ajit, maybe you can introduce the other half of your partnership here.
So I needed to really upgrade our clinical rigor. And that's where our Chief Medical Officer, Dr. Ravneet Dahilwal, stepped in. You want to come say hi? It wasn't a compromise of my clinical work or anything like that. This was an upgrade. I mean, she's board certified in
I can tell.
family medicine.
I know, I just looked
obesity
smart.
medicine. And
It's the glasses.
doctor for 10 years.
Okay. Well, now that I've got the real doctor here.
Yeah.
The most common application of stem cells, are we talking about trying to fix orthopedic problems? Are we talking about sexual health? Like with your clinics right now, what is the most, I guess, common request from a patient coming in? Because you paint this picture of stem cells kind of being, I know you didn't like to say miracle, but they have miraculous properties where they can potentially help treat any ailment. What's the most common?
So I think it depends on which patient demographic we're targeting, right? If we're thinking about women that are in their 50s, the main thing is going to be aesthetics, right? If we're looking at certain, like your guys' population in terms of athletes, then I feel like joint injections have been the most desired, right? And it's localized. And again, when we're talking about stem cells earlier, it can focus on that site of injury. Mm-hmm. So when you're doing a localized injection, it does target that area. And then men's health is growing quite a bit. I think we're learning a lot about, sexual dysfunction and how we can aid in that in terms of a P shot and kind of making a protocol based off that, including peptides as adjunct therapy.
Did you say the P shot?
Yeah.
What does that mean?
It's a PRP injection that you
Okay.
put in your penis.
Directly. That's. Tell us about your penis treatments.
So obviously, I would not know from experience,
Okay.
but
Don't want to make any assumptions.
no, make that assumption.
All right. Okay. All right.
So it has been very effective in increasing blood flow.
Okay.
So it's been the most effective in erectile dysfunction because you're basically increasing the blood flow by you're increasing growth factors, right? So the platelet-rich plasma, also known as PRP, works by increasing your growth factors in that area. And so growth factors can go into something called the EGF, which helps increase blood flow to that area. And so people have found it to be very effective with sexual dysfunction.
Interesting.